Hello everyone, my name is Isabel, and today I would like to talk to you about one subject that I spend lots of time, money, and effort mastering, and I am still mastering it. But I have gathered so much knowledge, and I really would like to share some of those with you. And that topic would be about dentistry, um, primarily everything that has to do with oral systemic cleaning, the hygiene, preventative care, longevity. So the most common dental myth that I come across would be the following. Myth number one: every time a person goes to get their annual or every 6 months checkup, they are really scared because the cleaning is gonna hurt. They think that it's gonna be horrible, it's gonna be bloody, it's gonna be uncomfortable. So this is clearly a wrong approach. There must be something wrong about that. Every time you go to get your cleaning done, and if it hurts, if it's uncomfortable, there is something very wrong. Most likely you do have something called gum disease, and gum disease, this is something that every single person out there gets. 90% of people out there are walking having gum disease, and they don't even know about that. And the reason for that is because gum disease, it's a silent disease. Only a clinician can diagnose if you have it or not. So the key with gum disease is to treat it early, and of course if you're just gonna get a cleaning done, all you're gonna get is a painful experience. Your gums are gonna be angry, and next time you come back it's gonna be the same story. So you do need to get the proper treatment, the proper procedure to get your gums healthy first, and then you can keep going with your every 6 month cleanings. Myth number two: after the cleaning, my teeth are gonna get white and I'm gonna smile white, and it's just gonna be beautiful and white. So this is not quite right, because cleaning does include a polishing component in it, but polishing can only do that much. It's only basically just removing the staining that you've got, and if your enamel naturally has more like a grayish or yellowish undertone to that, so no matter how much I will be polishing it, we won't be able to achieve the whiter smile. It will be brighter, but not whiter. So the only way to get your teeth white, only the whitening can help. Well, there are other ways to do that, but I'll get into those a little bit. Myth number three: your hygienist is gonna yell at you when you go because you haven't been flossing, and that's basically the main fear and myth. And I do agree that lots of hygienists are being very annoying, and they, like as we say, yell at you, but this is wrong as well. You do need to find the hygienist that you're going to be comfortable with, that you're going to be able to tell the truth, that yes, I haven't been flossing because my life has been a disaster. So this way, knowing the truth, she will be able to approach you in a different manner, maybe recommend something else, some alternatives, because it's not just about flossing. Myth number four: cleanings should be regular. And lots of people think that it's okay that if I go, like, let's say once per year, or if I go like a year and a half. No, it's not okay. Mouth is the dirtiest place in our body. It's basically an entry point. And if we're getting our nails done, our facials done, like once per month or once every 2 weeks, it's not okay to get your cleaning done. Cleaning of your mouth should be first, because again, this is the entry point. You're using your mouth all the time for eating, for smiling, for talking, for kissing. So you'd better make sure you take care of that first. And there is no such thing as getting too many cleanings done. Cleaning is always beneficial for you. There is no harm in it whatsoever. Myth number next, let me see what else I can add. Just today I had this like actually two new patients, and they told me that when they floss, it hurts and it's bleeding. So that's why they prefer not to floss. And this is completely crazy to me, because it should not be this way. Every time you floss, your gums should not be bleeding, and they only bleed because you're not doing it enough. And yes, if you tell me, yeah, but I do it every day and they still bleed, that means you're not doing it enough still. By the book, it says that we should be flossing after each meal, which is kind of like difficult to achieve. But if you are flossing every day and there is still bleeding, most likely you have gum disease going on, and you need to go see the specialist, the hygienist, for evaluation and the treatment. After the treatment, if you're going to be flossing every day, your gums should not be bleeding. So I think that's it for today. I will be sharing many more information with you, so stay tuned. Bye.